Hi everybody, it's Dr. Magnifico from JaredSpilvet.com. This young lady, she's not very young, but this young lady is Delilah. She is a diabetic cushingoid and Addisonian, and she has had such a problem managing her up and down hyperglycemia that she put a Freestyle Libre on that her owners picked up at the pharmacy, right? And how much was it?
They were the sensors are $35 a piece.
And then you use your phone, an app on your phone to read it. So she is getting it changed out. So she actually had 2 put in, which is a little unusual, but they wanted to make sure they were right. So we are going to take off the old one and put on a new one. And I will show you sort of how it kind of comes. It comes in a little package. And we have this funky dunky crazy spray release stuff that works great. So normally when we do a blood glucose check, we have to prick the skin, get a little drop of blood, and then use a glucometer, and you can prick a couple times a day. But if you need really constant reading, so 10 to 20, which is sometimes what we're doing in a day, then this is a much more efficient way of doing it. And what were the parameters? It lasts like
14 days.
14 days. It lasts like 2 weeks, and you can do as many times as you want to.
It updates once a minute.
Okay, awesome. Okay, so that's sort of what it looks like when we take it off. So there's a little tiny
that tiny little
sensor
piece,
that's going
yeah.
through her skin, and that's collecting the blood and the information.
How
little that is.
Yeah. Crazy.
So I have Dr. Graff is her veterinarian, and I have a couple of patients who are cats, and they're sometimes hard to do, or sometimes we've got these patients where they're just kind of going up and down and up and down, and it's hard to be pricking them 20 times a day, so it's much easier to use a phone and scan it. So this is one of the advances in medicine that we're super excited about.
Because they said to line it up.
Hi, pretty girl. Hello, pretty girl.
That is, right?
Hello.
Being a good
Hello. I know. She says, I can't believe it. I'm a patient again. And certainly for all of the times that we have to prick them going back and forth, this is a much, much easier way.
Absolutely.
You do it once in 14 days.
She didn't seem like it bothered her getting
No,
taken off.
no, yeah. It's really tiny. It's like the size of a hair.
Line it up with
I
that
think,
line.
see that window where your thumb is? I think that's the line you line it up with. And then
Yeah,
there's a
but
line that matches the sensor.
Yeah, that's what I'm not seeing. Is the
Hi,
at the
pretty
bottom
girl.
line.